Hello and welcome to Eyefinity EHR training. Today we are working again in the ocular exam room, improving our efficiencies using protocols. I'm Dr. Justin Manning, one of Eyefinity's doctor trainers, as well as the lead doctor educator for the Eyefinity education conferences. Today we have a bit of a 2-for-1. We are going to show 2 post-op visits and how we document them in the ocular exam room. The first visit that we're going to document is a LASIK post-op, and the second visit is a cataract post-op. So why don't we go ahead and jump into our EHR system. All right, now we start here in the overview screen of our patient, and this is our LASIK post-op. And what I'm going to show you, instead of jumping right into the ocular exam room, what we're going to do is we're going to actually start in the Chief Complaint HPI Review of Systems. So I'll tap on that, and I'm going to add a Chief Complaint. What I want to show you is that there's actually a post-op laser refractive surgery Chief Complaint. And when I do that, I'll just select that Chief Complaint, tap on both eyes, and then I'll go to my complaint details. And in this case, it's a post-op visit. Instead of being a follow-up, we're going to select post-op visit. Here's where we can select what type of surgery we had. And in this case, we'll say that it's a LASIK with femtosecond laser flap with custom ablation. The name of surgeon is a free text. We can put that in if we would like. Same goes for the date of surgery. Any associated symptoms, we'll say that there's maybe a little bit of fluctuating vision and dry eyes today on day 1. But quality-wise, we can say that the patient's distance vision has improved. I could go into review of systems and do a review of systems. However, this is a post-op visit, so it's not necessary, and I'm not going to. So just to review again what we've done with our complaints, we have our post-op visit information put in here. I can just go directly into my vision exam if I want to. And again, the only thing that I have documented, as this is day 1, is my uncorrected visual acuity, and we'll say that the patient is seeing 20/20. Now from here, I can move into my ocular exam. As we are using protocols, I'm going to hit more, go to my protocols. So what I'm first going to select is my slit lamp exam, as I'm not dilating the patient for today's post-op visit, nor looking at the posterior pole at all. So I selected that plan. Now, the next protocol I'm going to select is my 1-day LASIK post-op. So I'll tap on that and then hit save. And as this is day 1, let's review what gets pulled into our actual patient chart or our notes. Really what we have is our LASIK flap in good position. If there were any complications, we certainly could put those documentation pieces in, but we certainly hope to see that the LASIK flap is there and in good position. We'll go to our quick impression edit and review what plans we brought in. There is a post-op evaluation LASIK plan, and our diagnosis that we're actually going to use is post-op LASIK, and in this case, it's the right eye. So to take a look at what is in that post-op evaluation LASIK plan, we hit resume, and our location first off is our right eye, and this has been brought over again with our post-op day being day 1. Now, one piece to highlight is the question here at 99024 CPT. This is entirely up to you. This may be best to be used if you are working in the facility where the LASIK surgery was done. You are not co-managing it per se, but you are following up with the patient, and you'll attach that 99024 CPT. If it's your own office and you're not seeing the patient within the same office as the surgeon, you may not want to attach this, especially if you have a direct contract with that surgeon for the post-operative care. Again, as we know, LASIK surgery is an elective surgery. We're not billing any medical insurance for it, so it's entirely up to you whether or not to attach that post-operative code. In this case, we'll leave it turned on, but again, you could turn it off. Underneath our counseling or our plan for day 1, we're going to continue the regimen of post-op drops as instructed, and we're educating the patient to return to clinic if vision or symptoms worsen. From now, we can hit done. Going back to quick impression edit, we did also counsel the patient regarding non-adherence or non-compliance. I like to have this in here as LASIK surgery is important to do what the surgeon instructs in all of our instructions in our postoperative management. And we want to document that we counsel the patient on the importance and risks associated with being non-compliant. And then our follow-up for next visit is in 1 week for a post-op exam. So we can hit close and we can save our visit notes. And we're actually all set to go for that day 1 post-op visit, documenting a LASIK postoperative exam. Now we're going to move into our cataract post-op. All right, now we start in our overview screen for our patient as we're going to document a cataract post-op visit. I'm going to tap on Chief Complaint HPI Review of Systems because, again, I want to show you under Chief Complaint the post-op cataract chief complaint. And what we'll see is that this looks very similar to laser refractive surgery post-op complaint. And again, we're going to do a day 1 on the right eye. I'll go to complaint details. And again, this is a post-op visit. Type of surgery here at the top was cataract extraction with IOL. We can fill out as much or as little of this information in the chief complaint as we want. It's a post-op visit. There are no requirements for the number of HPI elements that we need. To show you, there's name of surgeon, which is a free text. There's type of IOL, the date of the surgery, any associated symptoms. This does not have to be documented. It's entirely up to you as to what you want to have in that HPI. There's no requirements for the number of elements necessary to be documented. So put in what you want to have in your complaint. So we'll save our complaint. Again, review of systems wise, there's nothing else that I need to do. We'll go into our vision exam just to review that we've done an uncorrected visual acuity and that we've checked pressures today on this patient. We're not dilating or doing any other tests as part of our post-op visit. If you like to do other tests on day 1, that is entirely up to you. But for the sake of documentation, we'll go into our ocular exam. We're going to go to more, and then we're going to hit protocols. After we enter our protocol screen here, we're also going to do another slit lamp exam. I'm not going to look at the posterior pole unless there's something in the patient's history that would prompt me to do so. And I'm going to go down to my 1-day postoperative protocol. And here's my 1-day cataract post-op. I'll select that protocol as well and hit save. And taking a look at our quick impression edit, what has been brought over in that protocol. This is super important to understand. What I have here are 2 specific diagnoses. The first, what I've documented as nuclear cataracts. This diagnosis is the diagnosis that the surgeon used and communicated to you when you assumed care of the patient. So if the surgeon used nuclear cataracts or combined age-related cataracts or cortical, etc., this first diagnosis is going to be the diagnosis that the surgeon communicated to you specifically. And I have it selected for the right eye. The first plan that I have is co-management. Let's look at that plan specifically by hitting resume. This is where we are going to get our surgical code. In this case, our operated eye is the right. We are assuming care, and then our CPT code that the surgeon used was 66984. If the surgeon used a different code, here's where you would make that selection. Whether it was the 983 or the 982 is entirely up to what the surgeon bills the insurance company. So I'll leave it at 66984 and then hit done. Going back to quick impression edit, the second plan that we have is setting the global period. We'll look at that plan by hitting resume. And this is where we are telling our system that the patient is now within the global period for their cataract surgery. So our surgery pick list has our cataract extraction. Again, we're in the right eye. Our global period is 90 days, and we just need to manually enter in the date of the surgery. As today is February 15th and it's day 1, we'll say that the patient had surgery on Valentine's Day. From there, I can hit done. We'll go back to quick impression edit. And now we'll see the second diagnosis that we have. The second diagnosis that we have is post-op cataract, again, right eye. And here's where we've documented some of our physical findings based upon our exam of the front surface of the eye. And I've also attached as an associated diagnosis the presence of an intraocular lens. That's going to make sure our ICD-10 code for pseudophakia gets put in. Underneath this diagnosis, I have two plans. Post-op evaluation cataract. To show you what's in there, we'll hit resume. We have all of these qualities here. If you are reporting on the outcomes of cataract surgery as one of your MIPS codes, you can put those values in under those qualities. Some of them are smart, meaning that those values will automatically be pulled in and sent out based upon what you document in the system. But the biggest pieces to have in here is that, again, right eye, day 1 is our post-op day. If we were seeing the patient on another day outside of day 1, week 1, potentially week 2 or month 1, we could put that information in there. We go to day 1 of our treatment regimen or recommendations for the patient, and what we're going to document is continue the antibiotic, steroid, and topical NSAID as instructed, and then again our recommendations for no bending over, heavy lifting, rubbing, or getting water in or around the eye for the first week. And from there I can hit done. And the fourth and final plan that we're going to have documented for our cataract post-op underneath the post-op cataract diagnosis is follow-up for next visit cataract. I need to see the patient back in a week for a post-op exam. I'm going to hit close, and then I'm going to save my visit note here. Before I save my visit note, though, I'm going to show you in the exam chart itself what actually gets documented. What I brought over from this same protocol is 2+ corneal edema, 1+ anterior chamber cell, and a PCIOL that is well centered. Now we'll save our visit note, and what we can see that we have is our procedure code. Here is that 66984 surgical code. It has our 55 modifier, which means we are assuming care and co-managing this case, that it was done in the right eye, and here is the diagnosis code used by the surgeon. Again, we decided to pull that post-op 99024 code in, and here are the post-operative codes, including the PCIOL. At this point in time, we are able to finalize our visit, and we're done. Before I finalize the visit, I want to make one final note, and that's to show this yellow circle here with GP. When we set the global period as one of our plans, it told the system that this patient is actively in the global period, and any services related to the cataracts will be at no charge. It will also give us our 24 modifier if the patient comes in with another problem, such as a red eye, and we need to treat that patient. But again, the patient is in the global period. If I tap on the patient's name, I will see, first off, when the patient was last dilated, but regarding our cataract surgery, I'll be able to see the global period is active. Again, that's that yellow circle, and actually what the patient is in the global period for. The patient was in the global period for cataract surgery on this date, and the patient is now 1 day post-op and has 89 days left on that global period. And at any point that we see this patient, we'll be able to access and see how many days are left from the global period. And now we're able to finalize our visit, and we're done. Thank you very much for your participation today. We've had a chance to go over a LASIK post-op visit as well as a cataract post-op visit. We got a bit of a 2-for-1 today. The cataract post-op is one area of documentation where we get a lot of questions. Again, to review that, we have two diagnoses. Our number one diagnosis is what the surgeon used to do the surgery, and our second diagnosis is the post-op cataract. The post-op cataract also has the PCIOL attached to it. We have two plans under each diagnosis. The first, under the surgeon's diagnosis, we have our co-management and our set global period. Under our post-op cataract diagnosis, we have follow-up next visit and our post-op cataract plan. Thank you again for your time, and we look forward to seeing you in future webinar series.